exposure incident.
So high risk exposure to your husband had it,
Right.
the wife should get tested. Yeah.
These things are just going in the door.
I know that.
It's they walk by. It's a sensor.
I know we're talking about masking, but are there best practices with how to take care of your mask and not touching it and like I am?
Yeah.
You know?
Good.
Good afternoon. I am Kristen Witt. I am a proud member of the Riverside Foundation team. Welcome to our virtual town hall today. We are so grateful to the community and our patients and their families for the support they've given us. And now it is my privilege and honor to turn it over to Mr. Bill Downey, CEO of Riverside Health System.
Thank you, Kristen. Again, my name is Bill Downey. I'm the CEO for the Riverside Health System, and with me today on our panel is Dr. Mike Dacey, Dr. Rebecca Sensidig, and Dr. Charlie Frazier. I think last time I was with you, we had two former members of the Air Force, and so we decided to broaden our panel. Dr. Dacey, who is a critical care trained physician, is a former member of the Army. Dr. Sensidig, who is our infectious disease lead, is a proud Air Force, former member of the Air Force. And Dr. Frazier, family medicine, is a former member of the U.S. Navy. So we almost got all of our armed forces covered here today. Before I turn it over to the panel, would like to echo Kristen's comments of thanks to our community. You all have been tremendous in your outreach to us. And also want to make sure we thank the members of the Riverside team. When this started, Riverside made a decision not to have layoffs and furloughs, and we think that has been a wise decision, as we have seen the first wave of COVID in the spring and now a second wave. And our inpatient, outpatient, provider teams, lifelong health teams have all done phenomenal work caring for those who have COVID-19, as well as caring for those who have come to us for their routine care or their needed emergent care, whether it be a heart attack, stroke, or routine outpatient procedures and services. So thank you to our team, and with that I'm going to turn it over to Dr. Mike Dacey.
Thanks very much, Bill. Thanks very much. And just to echo the thoughts of thanking you all for the tremendous work that everybody's done over the course of the since the pandemic started. It's just been really inspiring to see everybody do such great work on behalf of our patients. So thank you all very much. I just wanted to spend just a couple of minutes describing where we are in the pandemic state right now in terms of this part of the state, and then show you a couple of slides about how, because of all the great work that you all have done in terms of trying to bring the business back, how the business has come back quite a bit, and that's due to your efforts. So maybe I'll just go to the first slide here, if people can see that. This is a slide that goes back to April, the 1st of April, and when you look at it, it's the entire state of Virginia and all the COVID cases in the entire state. So you saw that the peak of the state reached maybe the middle of May or so, and then things came down very, very nicely. And then almost exactly after the 4th of July weekend, the cases started to go back up again. And as people started to get out and the economy began to reopen. But that slide there is a little deceiving, because if you take a look at the actual different parts of the state, this is the northern part of the state near Washington, D.C. What, 4.5 million people up there? And you can tell they came down very nicely. They had really, really hit hard earlier in the spring, and they really have not come back up again. So that's good. Unfortunately, where we are, this is the graph for the eastern portion of the state. And you can tell that we always had a fair number of cases. They came down a little bit, but now, again, starting after the 4th of July, really, really went up, and has started to come down slightly, fortunately, as people have become more cognizant of the protecting themselves, wearing masks. And so I show you these, and I'll show you the slide. This is the slide of the medical center here in Newport News, showing that the cases went down and then began to come back up again right after the long weekend. So I show you this because it's very, very important that you all protect yourselves. This is the rise in cases in the state is predominantly located in the eastern part of the state. So it's very, very important that people adhere to wearing masks, keeping the social distance 6 feet from each other, and doing whatever you can in order to make certain that you stay safe. Now, because we've seen an increase in the rise in this area, we've also seen at one point an increase in the number of team members that were out either on quarantine, awaiting testing results, or because they were high-risk exposure. And you can tell that going back just a few weeks ago, we had almost 140 people out. Now, it's come down, and if I showed you the most recent week, it's come down even further than that. I show you this slide because it really illustrates the importance of adhering to the infection prevention policies, the masks, being very, very careful, following all the right policies, because these numbers, now we have 10,000 people that work for the health system, but these numbers are pretty significant, although I will say better than just about all other health systems in the area, but still, a lot of people that were out of work, and I would say almost all of these people tested negative in the end, but they're out of work awaiting the test results or in quarantine. So just something to keep in mind. Now, thanks to all your hard work and all the great efforts that you've all done, we've seen an increase in our volumes, in our overall patient volumes. Almost every graph I could show you looks just like this. So if you go back to the beginning of the year, this is a graph of procedures, operations that are done in the health system. And if you look, typically we do about 1,100 cases or so, every week, and really, really dropped down when things got severe with the virus in the early spring. And now, thanks to all the hard work that you've done, it's come back up, and it's not quite back where it was before, but it's pretty close, and that's due to all the efforts that you have all done. This is just another example of that. This is the medical group visits, and if you look at that, medical group visits, again, pretty much back to where they were before. And again, I think this is because of some tremendous work on the part of all team members across the whole health system. So that's very, very encouraging, and there are still some areas that are a little bit short of where they were before, but we are encouraged by that. And then the last thing I want to spend a minute talking about are vaccines. So there are two types of vaccines I want to talk about. One are the vaccines being developed for COVID, and the good news there is that there's a lot of progress. There are probably over, Rebecca, 100 different vaccines in development, but 3 of them are really, really far along in development in the United States and in Great Britain. And it may be within a couple of months there's probably going to be some type of vaccine, which is really encouraging. And the good news here too is that the vaccines will have been tested, the United States vaccines will have been tested in 90,000 people total, all 3 trials combined. And so that's going to be really, really good. Riverside is applying to be an administration site. There's a complex process that you have to go through with the FDA and the government. We'd like to be able to receive the vaccine and then be able to administer that. And we'll find out about that within a couple of weeks, but we have applied for that. So a lot of hope on the vaccine front, and that's very, very encouraging. I think the second type of vaccine is the influenza vaccine, and very important that everybody get the influenza vaccine this year. Given how widespread still the coronavirus is, you don't want to have coronavirus and influenza at the same time. So very important people get the influenza vaccine. And we want to start that process a little bit early this year, but we're really going to push people to get that vaccine and get it early. So it's very, very important. And with that, just again, to thank you for all the hard work and great efforts on behalf of our patients and the community, and can't thank you enough. So thank you all very much.
All right. right. I think I'm going to be talking a little bit about what Dr. Dacey was saying. We'll just touch a little bit more on the infection prevention. As he said, there is still a very large burden of COVID infection within our community, and we have to be very diligent in keeping ourselves protected. And so the ways to do that are still the same. So first and foremost, we need to be wearing our masks. This is incredibly important. We need to be wearing them in public and whenever we can't social distance. I think what we have to remember, though, is that this includes when we're around family and friends. People tend to get lax when they're in break rooms or if they're at barbecues. And as you saw from the slides, it was after the 4th of July when people were together with friends and family that the outbreak started to increase. And so it's very important that you're wearing them when you're with other people if you don't have a 6-foot distance. The other important thing with mask wearing is that they're worn appropriately. A mask has to cover both your nose and your mouth in order to cover the respiratory tract, and so you need to make sure that that's covered. It should fit snugly, so that way you're not having lots of gaps within it where droplets could enter or leave. The other thing that's important for infection prevention is still social distancing. Social distancing is the best protection against COVID infection. So we need to limit our gatherings. We need to stay 6 feet away whenever possible. It's the most important thing that we can do to protect ourselves. Of course, hand washing. More and more we've been able to get hand sanitizer. You see it in stores. You're able to get things more. You need to make sure that you're washing your hands all the time or using an alcohol-based hand sanitizer. The other thing that Dr. Dacey talked on was the importance of influenza vaccine. Preventing the flu has always been important, but it's even more important now. The flu vaccine is not always 100% effective. However, it is the best way to lower your risk of flu-related illness and death. And so with our healthcare resources being utilized by COVID infection, we really want to minimize the use of our resources by influenza. And the way to do that is by everybody to get their flu vaccine. You will then reduce your chance of catching the flu. You will have less chance of having to go to the hospital for influenza. And like Dr. Dacey said, you don't want to have both COVID and influenza at the same time. So local areas, PCP offices, everyone's starting to get flu shots in, so you can call your office and see if they have it available. We do recommend that you start to get it starting in September, October.
Hi, again, I'm Charlie Frazier, and I'd like to welcome you again for being here with us this afternoon. I don't think I have to tell anyone that's watching that a lot of things have changed during the pandemic, but one thing that has changed that I think is really good is that we've certainly done more telehealth during this time. We'd done telehealth before, a lot of things like telestroke to care for our stroke patients and other issues to kind of spread the specialty expertise across the area. But during the pandemic, we've done a lot more visits basically with the physicians and providers in the offices. And it basically comes under 3 different flavors. One is e-visits, and that's for more minor complaints. And you can go on MyChart and fill out a questionnaire about whatever that complaint is. It could be nausea, diarrhea, or cough, or fever, or whatever. And that will come in, and the nursing staff will look at that, and then the provider will look at it, and then we'll respond back to you with recommendations. We can't always handle it that way, so sometimes we'll tell you that we really do need to see you, but it's a quick way for you to be able to put or to request that advice. Do it any time of the day or night or at the end of the day if you do it during the day. The other one is that we actually have done some scheduled telephone visits. And I've been in practice for a good while. I don't know that I ever thought about actually scheduling telephone visits, but there are times when we can actually do a lot just talking to you on the phone and managing or helping you manage your medications and the conditions that you have. So sometimes that is appropriate. And then the other one that we've done a lot of is actual video visits. And I can tell you that while you cannot do quite as much of an exam, obviously through the phone or through your computer, particularly if I know you already, or if you already have a relationship with your provider, we can do a lot with a video visit. Because if I can see you, see how you feel, and I can talk to you about how your conditions are going or how your medications are doing, I can help take care of you. So I would encourage you to take advantage of these new technologies, and they are available. It's just another way that you can come in and see your provider. So thank you.
Dr. Frazier, can you expand on telehealth visits and what specialties have this option and how this can help our patients?
Well, as may be obvious, it's not necessarily as easy to do this with all, specialties, but all of our specialties have the ability to do it. So if you want to do a video visit, for example, just you can, when you schedule the appointment, you can just ask for that. If you already have an appointment scheduled, you can send a message into that practice and say, hey, can I do this as a video visit? They will take a look at that, and depending on whether this is the first time they've seen you or not, or what the issue is that you're coming in for, we probably can do it as a video visit. If not, they'll tell you why not. I will say, though, that to do these right now, you do need to have MyChart. That's the patient portal that we have, and you can get an app for it, and you can do it on your phone. So if you don't have MyChart, I would definitely recommend that you get that, and it's easy to do. You can sign up it when you're in the office, but you can also go online. If you Google Riverside MyChart, you can go right on there, put your information in, and as long as it matches up with the information we have for you, you'll be able to get right into your MyChart account. So get MyChart and think about doing some video visits.
Thank you, Dr. Frazier. Dr. Sensenay, can you talk to us about the safety of the flu vaccine? Can you also talk to us about the vaccination rate? How many people typically get the flu shot, and what do you recommend?
So the typical vaccination rate for influenza is about 50% right now, which is way too low for us. Unfortunately, people are scared to get the flu vaccine. We hear over and over again that people think they get the flu from the flu shot. The truth is that you cannot get the flu from the flu shot. And so when the injectable flu vaccines are not live virus vaccines, this means that there is no active flu virus that is injected into the person. And so it's actually impossible for somebody to get the flu from the vaccine. I always tell my patients it would be like a bear rug coming back to life and attacking you. It can't happen. It's dead. So there's no way you can get the flu from it. It is a very, very safe vaccine. Some people do get some symptoms after the vaccine, and they can get myalgia, so sore muscles, even some low-grade fevers. That typically is your body responding to vaccination and creating antibodies. It's a good thing. It means that when you are exposed to the actual influenza virus, your body will be able to respond and make antibodies and fight the infection quickly. In terms of the 50% vaccination rate, we would like it to be more than 80%. And the reason we want that is because that creates a good herd immunity within the community so that less people are going to get ill.
Thank you, Dr. Sensenay. Dr. Dacey, would you expand upon the previous comments we've had and information we have out there on guests allowed in our facilities, especially with a loved one, to the emergency room?
Yeah, so one of the more difficult things about what's happened over the last several months has been limitations on visitation hours for family members, and it's been a significant strain on both patients and families. There was one point where we were not allowing any visitors at all in the hospital at all, and that was very, very difficult. Gradually, that's been loosened now, and specifically in the emergency departments, we are allowing one visitor going to the back with the patient. The difficulty there, though, is that sometimes emergency departments can be very, very busy places, and so sometimes no visitors are allowed because of what's going on behind the scenes, if there are trauma patients or seriously critically ill patients. But in general, we're trying to allow at least one visitor to go back and be with their family member. But we'll continue to watch this, and hopefully we won't have to restrict visiting hours again. But we know it's been a significant stress on both patients and their family members.
Thank you, Dr. Dacey. Mr. Downey, how can community members continue to support Riverside and our team members?
Well, I think as you've heard from the panel, clearly what you are doing and what you have done around wearing masks, hand washing, social distancing is critically important. It takes some of the pressure off of capacity at not only Riverside but across Eastern Virginia and other facilities in our region. As you heard from Dr. Sensenig, it clearly is important that we get flu vaccines this year. It's always important, but a special reminder that if we can limit the number of people that get flu, that again hopefully will help reduce the number of people who have to come to their primary care offices or to the emergency department or who need to be admitted. And I would say that we continue to thank all of the people in the community who have been so supportive of our team members. We have continued to get gifts for team members of support of food. We've continued to see the importance of supplies. People have continued to drop off face masks that can be used for visitors who don't have access to masks. And we are continue to be grateful and thankful because we have seen and continue to see support of our foundation. People have continued to reach out and give to the foundation, which supports Riverside, which allows us to support our patients, our residents, and our team members. Just if I are we finished? Nope. I would just want to echo a couple of things that were mentioned, and you know, while we haven't cured COVID, I think as you'll have heard, we have gotten a better understanding of how to treat it. And I think we've seen really significant progress with the use of certain drugs, steroids. The remdesivir has clearly made a difference. I think we're also very fortunate, and again, we would love to see even faster turnaround, but we have seen an increase in the number of people who can get tested. And Dr. Simpson, maybe you could comment on who should be tested and why. I think that continues to come up as a question that we're always asked.
Sure. So, you know, we do have increased testing capabilities. However, we do still need to be cautious in how we use them, especially as we're concerned that there may be increased in the number of COVID cases as we come into the fall and the winter. And so we need to conserve our supplies so that we can have them in the future. Right now, our testing is for people who are symptomatic. So if you have symptoms of COVID, then you come to the ER, and if you are going to be admitted to the hospital, then you're going to be the priority for testing. The other people who we are also testing is if you have a known exposure to COVID, a close family member, and you are being quarantined, then we will test, especially if you are an employee, to know if you can come back to work at that time. For the more mildly symptomatic, that will really be dependent on your physician who you see. Since there is no real treatment for outpatients with COVID and we are trying to conserve, not everyone will be tested at all times.
Thank you, Dr. Sensenig. Dr. Frazier, can you talk to us about the symptom checker that we have online, where it's available and how to use it?
Sure. That's another form of, I guess, in some ways, telehealth, but it's an automated tool, but it's been in use for many, many years and has protocols behind there. In fact, if you call into Riverside Nurse with a symptom, they will go through the same protocols, ask you the same questions as you would get if you go onto this tool. It is called Symptom Checker. You can Google or use a search engine of your choice and put in Riverside Symptom Checker, and you will find it that way, or you can go to our website, riversideonline.com, and over on the left-hand side, there's a panel with some of the major tools on the website, and it says Symptom Checker there. It's not just COVID-19, although there is a section for that where you can put in your symptoms if you are concerned about that. But any symptom, it could be headaches or abdominal pain or shoulder pain or any symptom, and it basically will go down through there and make a recommendation on whether or not you need to call 911 if it's something very serious, or whether or not you need to see a physician quickly, or whether it's something that you can, even to the point to something that you can handle by yourself. So check that out. I will also mention we do have a sort of a little chat bot on the website as well. That's down in the right lower corner. So if you're particularly concerned that you might have COVID-19, again, it will lead you through some questions there as well and make some recommendations on whether you need to be seen, be tested, or call Riverside Nurse or whatever. So we have a couple different tools on there, but please check out Symptom Checker.
Thank you, Dr. Frazier. We'll turn it back over to Mr. Downey.
Well, thank you. Thanks to the panelists, as always, great information. We are so fortunate to have such an outstanding team here at Riverside. A couple of things. One, as we come into next week and the Labor Day weekend, a good reminder, as you saw from the graphs and from the discussion from our panelists, that is unfortunately a time when we'll be out and maybe in more contact. So it's a good reminder, what you heard today, of practice good social distancing, hand washing, wear your mask. It doesn't mean you can't see people, but you just need to be mindful when you're in groups or with people, including family and friends. Can't echo enough the comments of Dr. Sensenig about the flu vaccine and how important that is, especially this year. And want to close with a huge thank you to our community for all of your support, not only this year, but every year of Riverside. And a big thanks to all of the 10,000 team members at Riverside who have continued to go above and beyond in caring for our patients and residents and their families. Thank you, everybody.